Good afternoon, superintendents and guests. As always, we have our superintendents from our public schools, and we also have invited special guests from the Kentucky Non-Public School Commission, as well as representatives from the various Catholic diocese schools. We understand that this information is very helpful to them, so we want to continue welcoming them during this time to get this accurate and helpful information from the Department of Public Health and for all the other information that you'll be receiving today. And of course, we also have representatives from the Kentucky School Board Association, Kentucky Association of School Administrators, Kentucky Association of School Superintendents, and various few other K groups. I believe the Center for School Safety also joins us, as well as KHSAA. So thanks, everyone. We're going to quickly get started. We have Dr. Stack with us today, and he only has around the first 30 minutes, and then we'll have other officials from the Department of Public Health to stay on for questions. But before we get to Dr. Stack, Tony, I'll turn it over to you for about 1 minute.
All right. So just a real quick thank you to all of our superintendents for submitting your pictures for our Kentucky's Tribute to the Class of 2020. That ran this past Saturday, and was, I think, a very good showing, very good success. To date, we've had 3,400 viewings on the YouTube channel, and really just appreciate all the pictures that have been submitted. And a huge shout out to Megan. And this is Megan. She is the one that edited everything and put it all together. So just huge shout out to Megan for doing it all and putting it all together. It was an incredible job. 1,500 photos, putting all those videos together. And you can click on this link here when you get into your PowerPoint and rewatch the Lieutenant Governor as she hosted the entire thing like a natural, and just wonderful. So just wanted to share that with you, and I appreciate everything that you all did to make that a success. And then again, the next thing is just a reminder that our commissioner search is going on. And again, this is the same slide that you've been seeing. And the deadline to submit materials is May 31st. And with that, we will go on to updates with the Kentucky Department of Public Health.
Again, as I said, we want to welcome Dr. Stack, as well as Deputy Commissioner Dr. White. You all may remember her from the very first webcast that we had during the COVID-19 era, and as well as the Department of Public Health Branch Manager, Emily Messerly. She was also, I think, on that webcast. We're glad to have them with us today. Dr. Stack, as I say, can be with us about 30 minutes. We've been hearing, Dr. Stack, from superintendents that we thought this would be a really good time to give a good overview of what you anticipate schools encountering as we reopen schools. We're continuing to get a lot of questions from our districts about the social distancing requirements and the background of the 6 feet requirement and some of those things. And the superintendents are bringing those questions and concerns to us because they're hearing those in their community. So, and just so everyone knows on the webcast, we also plan on having public health back again on next week's webcast. Dr. Stack probably will not be able to join us, but we'll have the others back on next week's webcast because we anticipate additional guidance coming out that affects the sanitation standards and all the other things that we will need to do to reopen our schools. And so as we get into that, we of course want to continue to have these conversations with our public health officials. They've been very gracious kind of on short notice to come on today to help start that conversation. And as they hear concerns and questions from you, that will then in turn allow them to go back as we all meet together this coming week to finalize the guidance and make sure we're addressing the concerns and maybe some barriers that you all are seeing in school districts. So with that, Dr. Stack, I'll turn it over to you.
Well, thank you very much, Commissioner Brown. It's nice to be here. I'm very grateful to my team, Dr. White, my clinical deputy commissioner, Dr. Messerly, who works primarily in our immunization branch, but has helped a great deal with a number of these issues related to guidances for different industries coming back in Healthy to Work. And then, of course, for Rebecca Gillis, Becky oversees our preparedness division, and so her area has been primary responsibility for the disaster, the emergency response efforts, and coordinating our efforts on our end. So you're in very capable hands with all of them, and they'll go into the additional details. What I am here today, I think, primarily to do is to try to address for you some background about the general nature of this disease and how we got where we are now, and where we're going to head. And the where we're going to head obviously plays directly into what you are all working with to try to figure out what going back to school might look like. So you already heard these things, but real quickly, COVID-19 is a coronavirus. It didn't exist in the human population until late 2019. It started in China, it spread around the world, and it did so very quickly. This particular disease is troublesome for a number of reasons. It spreads very easily. So we don't know precisely, because it depends on a number of variables, including population density and personal hygiene practices, but it may spread on average from one infected person to 3 others. I've seen ranges as small as 2 and as big as 5 to 6, but 3 is in the ballpark. And this means one infected person can directly infect up to 3 other people on average, and each of those people can subsequently infect another 3, and so on and so on. And this is really challenging because that's a higher transmissibility rate than influenza, which is less than 2, and it makes it much more easy to spread. The other thing is this disease is not currently showing any signs of seasonality. So a lot of us were hoping for a summer break. I don't think it's a reasonable assumption to count on a summer break. It is not at all certain that will be the case. So you have to plan for the worst and assume that it's not going to go away in the summer. And so efforts to try to rely on that are not going to be. I'm sorry, I'm halting as I do this because I'm trying to get my screen so I can see a little bit better. I'm a novice on this particular platform, so I'll just move on. So I don't think we can rely on the seasonality of this disease. So what we did was the only intervention we had available, which was traditional public health, which was to keep people away from each other. And we did this in a scale and at a pace that really is unprecedented in the modern era. I would say that there are some who have unfortunately become either skeptical or dismissive about the severity of the illness or the motivations for why certain actions were taken. But when you look around the world, whether this is in a country that is communist, socialist, a dictatorship, or a democracy, or any other form of these different types of governments, many similar actions have been taken the world around. And here in our own country, it really didn't matter whether you were a Republican or a Democratic administration, the same steps have been taken. Not uniformly, unfortunately. If it was more uniform, it probably would have been even more effective, but pretty globally across the country, we've done these things. There will not be any vaccine until at least 2021. Even at the fast pace they hope to move, and even with the many steps they're trying to shorten by producing vaccines not yet approved for release, if they show promising signs, it really won't be until 2021 at some point we get a vaccine. So we have to find a way to get through the balance of this year at minimum with the tools we have available. There are no current treatments specific to this disease, so it's all supportive care. And notwithstanding any media coverage that you see or hear, all the other treatments that are specific to this disease are still considered experimental and are not yet proven to be effective. So I'm hopeful that we'll find some kind of therapeutic sooner than a vaccine, but that's hope, not reality. And at present, they don't have a treatment that is any better than keeping yourself from getting infected. The statistics overwhelmingly say that the vast majority of people will do just fine. So 80% or so have no symptoms. That's been relatively stable as much as we've known about this disease over the last few months. But the challenge is for the 20% that get illness, a substantial proportion of those get sick very badly. And the mortality rate, particularly as you age and go above 60, starts to climb in a very terrifying and unacceptable manner. The other problem with this disease is because it spreads so easily and because the entire human population is susceptible to it, so none of us had any immunity to it when it started. When people get infected at a very brisk pace, it overwhelms the healthcare system, which means then you don't have hospitals available to take care of folks because they get overfilled and there's no place to put patients. Now, this is important for all of us because if the hospitals get overrun, they don't have space not just for COVID patients, they don't have space for anything. And so that's the reason why we shut down hospitals across the country and kept them open only for emergency medical and surgical needs, was to make sure they had capacity to take care of the sickest people who needed care and weren't filled up with folks who could wait a little bit longer safely. And also, we didn't have access to gowns and gloves and masks and face shields and sanitizer, the kinds of things that we needed in order to safely keep healthcare workers operating and also to keep patients safe from getting infected. So those problems are not yet solved either, though they are showing signs of improvement. And then the third and the final roadblock was we didn't have access to testing in any widespread manner, and we had to build that capacity. And in fact, we're still building it now, and we're going to have to find ways to make it available through the more normal paths, which would be doctors and clinics and hospitals, and probably some other ways which would not be traditional because of the nature of this disease and the need for us to test very widely. For the kids, for the children that you all take such great care of, overwhelmingly, they'll do fantastically well. The vast majority of kids won't even have any signs or symptoms of illness. The problem is, it is pretty clear they do get infected. They just don't have bad disease. And when they get infected, they can take that infection home and spread it silently to others. And that means parents and grandparents and others who themselves then could have the very terrible health outcomes we're worried about. So schools were closed because of the concern that children would spread the disease widely. And we don't have a good answer for that yet, unfortunately. And so we're going to have to kind of continue to struggle along through this. As far as the small number of children who get the inflammatory syndrome that can be related to this, that's a sadness in its own right. And for the kids who get that, it's very dangerous. But it's a very, very small sliver, as far as we know, of the total number of children who get infected. So we will have to hope that that remains a very tiny sliver, but at this point in time, it appears to be the case. So we will see as more time passes. So as you look to plan for your upcoming school year, here's the challenges in the context of what I shared. We don't have a vaccine and we won't have one this year, so it's not going to help you for school year this year. We don't currently have a treatment, and we're not likely to get one wide scale before the school year is fully underway, so you have to plan assuming there's no treatment. So what we have to do is then rely on social distancing and other public health measures to reduce the risk of infection. So that means thinning out ourselves and the density where we come together. And the reason we say 6 to 10 feet for a distance is because when we talk, we spray a little mist from our mouth. When we shout and when we sing and we yell, we spray that mist in larger volume and over greater distances. And that distance is felt to be 3 feet or so, and they doubled it out to 6 feet to provide a little margin of safety. The reality is it can be a little further than that if you're shouting or screaming or singing real loud. So when we tell you to keep people more than 6 feet apart, it's because it decreases the likelihood that they're going to spray saliva, which carries the infection to other people. When we ask you to have people wear masks, it may provide some protection to the person wearing the mask, but it definitely provides protection to people around that person. So particularly since children can frequently have no symptoms and spread the infection so easily, if they are wearing a mask, it helps keep the infection to them and keeps it away from others. All of us know, though, these masks aren't terribly pleasant and comfortable, and it certainly interferes with our ability to be social and see facial expressions, which is a real social loss. It's just that the other consequence of spreading infection is pretty severe for people most vulnerable. So it's a step that we need to take if we want to be able to come closer together with each other. And then enhanced hand hygiene is very important. Well before this, we knew that if there was a single thing people could do to reduce the spread of infection, it was to wash their hands more often with soap and water. And all of you who are educators know that this is not a strong suit for children, let alone adults, but certainly not for children. So as you look to your plans to conceive what school might look like in this new coronavirus world, that distance of more than 6 feet between students and faculty, universal masking in any situations where people are in relatively small spaces together and that 6 foot distance is not attainable, and enhanced hand hygiene are very, very important. The surface cleaning is also important because this infection does live on surfaces. And unfortunately, when these new reports come out, sometimes they're not interpreted within the right context. The CDC last week, I believe, commented that the disease may not live as long or as much on or be transmitted on surfaces as much as someone thought. But we knew all along that if you baked it in the sun, it wasn't going to live terribly long. And if you had a cardboard or paper, that it probably didn't live very well on that surface. The problem is in a cruise ship where you have metal and steel in a cold, dark environment, it lives for quite a while. And so it really does depend. And if you have a child sitting at a table or at a desk, and they're there for 45 minutes coughing and sneezing on the desk, and then someone else comes and sits down right after them, it is quite possible that you could spread infection. So surface cleaning is important, particularly for high-touch surfaces, which in your setting, like everyone else, would be things like doorknobs and handles to cabinets and shelves and drawers, but probably also a desktop if kids are sharing different desktops. So when you look to the fall, it's tough because a lot of the measures we're proposing for phase 1 and phase 2 reopenings have to do with decreasing the density of spaces. So trying to operate a restaurant at 33% capacity or operate other venues at reduced capacity. And it's very difficult to see how that works with the way schools are financed and also with the ways that parents rely on school 5 days a week, not just a couple of days a week, so that they can go to work and their kids can be somewhere safe and being educated. So the challenge we all face is substantial. I don't say these things to undermine our confidence that we will find ways to overcome them, but I do say them at least to be sobering in the sense that it is a big challenge. And I have not seen any real good solutions yet for these trade-offs between bringing large numbers of children back together where they can infect each other and then take infection back home, relative to the other cost to society with having all these children not getting their education, perhaps falling behind, and their parents unable to work as reliably because their children aren't in school. So they're very real and very serious trade-offs. And I really thank you for your partnership as we try to address them. And I will say one other thing because it's in the news these days. We have to be careful with the testing. The different types of tests have different values. The one that people swab your nose, it checks actually for the presence of infection. And in somebody who has a fever and a cough or other symptoms, it's very reliable to find out that someone has the infection. These antibody tests have to be interpreted with a lot more complexity because, let's put it this way, if the test finds 100% of people who have the disease, but 95% of the time it's reliable in finding people who don't, that means there's a 5% positive or false positive rate. And so what this would mean if we sample 100 people in a situation like we have in Kentucky when less than 5% of the people are infected, you'll have 5 true positives, 5 false positives, and that's a 50-50 chance that getting a positive antibody test means you've actually ever been infected. And so those concepts are pretty complicated, and it gets very easy for people to get led astray by getting a test and misunderstanding what it means. So I'd encourage you all, because people will turn to you saying, what does this mean? Or doesn't this mean my kid is safe, or I don't have to do these things? It doesn't mean that, at least not at present. And we have to be very careful how we interpret these things. So Commissioner Brown, I was here to offer the kind of an overarching perspective. I'm happy to take any questions if people have it before we hand it back over to the rest of my team to interact with your larger audience about any more specific things you have planned.
Sure. Tony, do you have any questions coming in on the soapbox yet? That
I
would be
do.
appropriate for Dr. White or for Dr. Stack?
I do. There's a couple in here that are just generally speaking about some of the guidelines in relation to the school buses. There's a large concern, and I'll go ahead and just state one of those. Give me a second to get the screen. So the question, and this has been highlighted several times, the CDC guidelines published for school buses has been to put one child on a seat every other seat. We can't transport like that, and if we don't transport, we can't have school. Is there any realistic guidance for school buses?
So I take that question with the sincere challenge it represents, and it is a sincere challenge. I get that. The things I mentioned about the density are real challenging because we rely on on packing people together, and that's not just in school buses. It's in classrooms, it's in concert halls and sporting venues and restaurants and all sorts of other places. And so it's an enormous challenge, and I don't have a good answer for that. If you put them all too close together, they end up spreading infection. And even if we tell all the children to wear masks, we see how successful we are with adults, unfortunately, and children aren't likely to be much better. If anything, they're likely to be less compliant. So no, I don't unfortunately have a good answer for that. It's a real acknowledgement of the challenge we face. And I don't want to undercut it by pretending that there'll be an easy answer, because I'm not aware of any easy answers for that one.
I think you're muted, Tony.
Sorry about that. The next question is, what is the guidance on whether or not all staff and students will be required to wear masks for the 2021 start of the school year?
So at present, and again, all of this is it's fluid in a way that's annoying for all of us. Okay, so let me just be honest with that. The fact that this guidance changes and that it continues to evolve is a challenge for everybody. But that being said, the guidance is unlikely to change. That if people are coming together in a relatively confined space, and a classroom would certainly be that, a school bus would certainly be that people are going to be asked and expected to wear masks when they're together. It's tough. It's tough to imagine going, 6-7 hours in a school day wearing a mask all day long, which is, again, one of the real challenges, but it's the only way we have to minimize the spread of infection. And let me give you just a few other things to put that in context. When they did they found that there was a choir in Arkansas. They had 67 people came together, one infected person, and 87% of the people in the choir were infected as a result of that one person who had the coronavirus. And so it's incredibly easily transmitted, and particularly when you have children who are happy. It's one of the things we like about them, right? They like to laugh and joke and shout, and when they do that, they're spraying saliva and mist in the air, and when they do that, they spread infection. And so the masks are likely to remain part of our future for quite a while, and I don't have any relief to offer on that either, unfortunately, because that's just one of the simplest and easiest things we can do to try to minimize the spread of infection.
Okay, there's a question here on whether the Department of Public Health is recommending or would recommend testing all employees and students for COVID prior to returning to school.
On this one too, it's a challenge because there is value to testing, and we're going to have to test a lot of people a lot more commonly than we have been. The flip side, though, is it is a snapshot in time. And so if we test everybody and find that they don't have infection, the result could change the next day or 2 days later, and all it takes is one or two people in an environment for an infection to rapidly spread. So we don't have specific guidance yet out about mandatory testing. I don't think we would discourage testing. It certainly would not decrease the likelihood of infection. And in fact, if you found that there were a certain number of people who had infection and they were asked to self-isolate from home until they were outside of the quarantine period, like a 2-week quarantine period if they had no symptoms, it would certainly decrease the likelihood of disease transmission. So I think that is a reasonable thing to consider doing. But we don't have guidance that mandates that yet at this point, at least not that I'm aware of.
So we have some superintendents that are basically summing what is being set up as, or as what is being said as, it sounds as if they cannot open in the fall because they feel like it seems like it's going to be impossible for them to operate under these guidelines. And they just want to know if you have any advice for them in terms of how they're supposed to work around this.
I wish I did. So here's where we are right now. So we're in phase 1 of this reopening. The reopening, and look, I've been pretty sanguine about this everywhere I've talked. And if any of you have seen me on news or with the governor at his 5 o'clock press conferences or on any of my public television interviews, I think I've been pretty consistent on this stuff. The economic and the social consequences of this disease are horrible. The health consequences are horrible. The difference between this is if we had not done some of these things, if we had happened across the United States, what happened in the city of New York, the number of deaths would be multiple hundreds of thousands, not the 100,000 plus that it is right now. So these trade-offs are really severe, and so what we're trying to do is respond to society's legitimate needs to come back together, but do it in a graduated way. So I think what we will find is we'll see in early June if the states that opened up really quickly in the beginning of May, if they start to have a resurgence or an outbreak, and that will help inform if in Kentucky we should continue on the pace we're on. I think, like the governor has said repeatedly, his goal is not to be the fastest or the slowest. It'd be okay to sort of try to be in the middle as far as the pacing so that we can allow education and healthcare and economic activity to resume, but to do it in a manner where we can see and learn from what happens in other states. So I think what I tell you here today and what I tell you on June 15th or the third week of June might be a little bit different if we see that we're not having a big resurgence. But if we start to see that as we relax these restrictions through phase 1 and into early phase 2, we start to see a resurgence of disease, I think that's going to have to inform the decisions we make. So again, I wish I had more reassurance, and maybe my team will have a little additional reassurance to offer, but the challenges are significant. And it doesn't mean we won't let school open up. And it may mean we have to accept that when school opens up, that there are more kids together than we would prefer because the counterbalancing trade-offs of having them fall further behind in education, of having parents who can't be at work, that those things are so substantial that we have to try to figure out a way to navigate the trade-offs. So I think it is premature for us to reach the conclusion we can't have school yet in the fall. I think there are going to be a lot of states who do have school in the fall, and Kentucky may well be one of them. But unfortunately, I think we need the benefit of a few more weeks just to try to get a better trend line, because we're having to make these really weighty decisions, your superintendents and also us, based on real-time learning. It's like building the plane when you're flying at altitude, but that really is what we're doing.
I think you might have time for one more question. The question is when collecting materials, how long should these items remain untouched to ensure that there is no spread of COVID-19 when handled again?
I think most materials are okay after a few days. And honestly, if, that is not likely to be the primary mode of transmission. I think people should be much more concerned about the coughing, laughing, sneezing, that the kids who are close together got a runny nose and they rub their nose and they put their hand on their buddy, or, that's a lot bigger risk than the materials. Now, for little kids, I would try not to have cloth and materials, teddy bears, things like that. Those things can't easily be cleaned necessarily. Surfaces that can be wiped down between kids should be wiped down between kids whenever possible. in the regular school environment, I saw in one of our documents lost and founds. I'm not really so sure we need to get rid of lost and found pins myself. I think we can navigate that, just leave things for a few days, and the virus will probably just inactivate itself and be okay. So a few days is what I would probably say.
And then do you have time for another question?
Sure, go ahead.
Okay. So there's a concern about our students with special needs, ones that may need to actually be, with sensory issues or present different challenges with wearing masks and not wearing masks, and not, if there's any advice that you all have in terms of guidance when it comes to those particularly special needs children.
So in those instances, whenever it's not safe or developmentally possible, then they just can't wear a mask. And that's an accommodation that just has to be made. But then the people who are with them should wear a mask to try to minimize their risk of spreading infection to the individual who can't comply, and also in small measure to hopefully lower their risk of getting the disease. But so masking should be done whenever it is possible. But when it is not safe to do so or not possible because of developmental or other reasons, then Kelly, could you? Then it just can't be done, and that's the reality, and we understand that. That should be in our guidance that we understand that. And now I am sorry, I have to go. My chief reminded me I have a 2:30, but I'm sorry that I have to leave you on an unhappy note.
Thank you,
folks,
Dr. Stack.
You're welcome. And Commissioner, I would not leave the audience wanting to despair, all right? I mean, but the reality is this is the single biggest public health crisis we've faced as a species worldwide, since the Spanish flu. I think we have faced challenges, we have faced threats, we have overcome them, we will overcome this. Just like the governor says every day at those press conferences, we'll get through this together. And I sincerely believe that, and I believe him to be correct. But that doesn't mean we won't face challenges as we navigate this. And there are very serious limitations because unlike most problems we face, we have not yet found some kind of intervention that makes it possible for us to very quickly overcome this. And until we find some intervention like a vaccine or a treatment that enables us to overcome this more quickly, we are all going to have to pull together and try to, either accommodate by getting over this, the mask that none of us like wearing it. I'm glad I'm on a Zoom call or a Microsoft Meetings call with you, so I don't have to wear this. But the reality is any in-person meetings, we got to wear these things because they protect other people from us. So we will get through it, though, and I thank you very much for all the work you're doing, and I'll leave you now in the capable hands of my colleagues, okay?
Thank you.
Thank you.
Thank you. Take care.
Okay, so I have the PowerPoint. I'll go ahead and share that, and I will mute myself.
And we'll just continue on with Dr. White, Dr. Meserly. I think there's some others from DPH, and then of course we'll have questions are still coming in. We'll have those at the conclusion of the additional presentation.
Is the screen showing?
Yes, it is, and I forgot to unmute myself. Hi, this is Connie White, and I'm Deputy Commissioner for Clinical Affairs for the Kentucky Department for Public Health, and I'm a gynecologist, so that should make all of you feel really comfortable that you've got a gynecologist talking to you about a respiratory infectious disease process. But I think this slide is a better segue, and this is a quote that I took directly out of the CDC guidelines. We're going to give you a whole lot of information today that is right out of the book of what everybody should do. And when we say should do, please remember that there's a feasibility, a practicality, acceptability, tailored. What does your community need? Every community is different. A high school in a large city is not going to be what a high school in Louisa, Kentucky is going to need. And I'm not picking on Louisa, I just like that name, and I always use Louisa as an example. We know that school administrators can lower the risk of COVID-19 exposure and the rapid spread. You're going to have a huge percentage of our population in your care every day of the weekday for 9 months or whatever the school year works out to be. So you can lower that risk of exposure and spread. But from everything I know about educators, they are built to be creative. And so as you listen to this, if you could listen and put your creative hat on and think, okay, I could take that comment and how can I make that work in my school system, in my school bus, in my playground? How can we take these guidelines and figure out what will work for me? What creative solution can you come up with? Next slide. So the things that I want you to think about are these 4 things, and the women that are going to talk after I am are the subject matter experts on these areas. But the social distancing is so critically important, and I think Dr. Stack explained that really well. I can't give you a shot to prevent this infection. I can't give you a pill or a nasal spray to prevent this infection. We basically have got nothing right now. I have learned to say, I don't know, more times than I've probably ever said in my life. And as a physician, that's very hard for me. I like to think I've got some data to back me up, some double-blinded placebo-controlled trials I can tell you about. All we have are basic public health guidelines and common sense kind of issues right now to present to people. So as Dr. Stack said, we don't think it's seasonal. Brazil, which is in their winter season right now, is having a huge problem with this virus. It doesn't seem to care. It doesn't seem to care about much of anything other than waiting around so it can get into respiratory airways and cause organ failure in people, and they die. So the more we can think of ways to distance our children, to distance our staff, that is going to be helpful in preventing this infection. The next one is a very difficult one, and I don't know how you overcome this in your school system, because I've learned a long time ago that you get reimbursement by the number of children that are sitting in a seat in your schoolroom. So if public health comes in and says, little Johnny has been exposed, his mother has been exposed, or his mother is infected rather, Mama's got the COVID-19, so Johnny, even though he's perfectly well, is going to need to stay home away from others for 14 days. That really hits your bottom line. And so those are conversations that I know you folks are having, and how do you get reimbursed for that? But if I have COVID-19 and my son is little Johnny, it will be 14 days before we know for sure whether little Johnny has this infection and is over it. Little Johnny may have no symptoms at all. That 14-day window is the period of time we know that the infection will show up and go away. And so if Johnny says, well, but my mommy has got the infection and I want to go to school because I'm not sick, that's a conversation that we're going to have to figure out how to tell kids, because that's going to be hard for them to understand. That's going to be hard for your bottom line. I don't have a good answer for that other than to say there's medical reasons for doing it that way. Hand washing and face coverings, and this will be covered in greater detail as Dr. Stack was talking about that church choir, or it wasn't even a church choir, they just happened to meet in a church. We know lots of mass gathering situations where the original index person, we call them, that had the infection, and they may not have even been sick yet, was managed to infect a whole host of people. So what kinds of things can we keep? I love the way he said mist. I always call it, pieces of spit, because that's really what it is, and moisture that comes out of your nose. So how do we keep that from hitting that other person? One is with the face mask, and it can be a cloth face mask. It doesn't have to be inexpensive. Please don't get an I-95s. Those are for healthcare workers. But anything that's going to put a barrier between my face and your breathing is what's going to be important. And then for that moisture that gets on a surface, if you touch that and then touch your eyes, mouth, and nose without washing those hands, there is some transmission. Like Dr. Stack said, it's not as high as respiratory moisture, but it still is there, and it's certainly not a risk we take. So the hand washing. And then the fourth point is cleaning and disinfection. How do we clean those surfaces? How do we make sure no one touches a surface and infects themselves? So if you can just picture in your mind, you've got a student, how can you get that student through the day with the most social distancing possible, not in the contact with their peers if they are either infected themselves or they are a contact. And the third one being hand washing, face covering. How can I keep from infecting others and infecting myself? And that's where the cleaning and disinfection comes in. Okay, next slide, please. And I do agree with Dr. Stack. I don't know, the governor's office keeps talking about doing away with lost and found, but anyway. I think you can just store things away and put them in Ziploc bags or something, because I know if I had lost something at my school, I would be very upset if somebody just pitched it because it happened to be COVID season. There's a lot of things I want to talk about. One, and this is, I probably shouldn't have put this up there unless I had a conversation with Robin and her team, but the school resource coordinator and your district health coordinator, the people that are doing this call met yesterday. We are very interested, if there is an interest in any of the schools, of having some kind of a special webinar, regular webinars, whatever might be helpful to keep your health resource coordinator up to date on what's happening with COVID-19. As Dr. Stack said, 3 weeks from now, things may be very different. That's health resource coordinator needs to kind of be your go-to person to get the latest information. And we are very happy to arrange something like that if you think that would be useful. I don't want it to be another, oh my goodness, burden that somebody has to have. But sometimes things change here twice a day. They certainly did in March as everything was changing. So we are very open to and interested in being a resource. If it's just a 30-minute, here's the latest thing that's going on, what questions do you have, or whatever might be helpful, we are happy to do that. Grouping students, you're going to hear about that. And I know, again, that grouping students in homerooms and letting the teachers move, grouping students when they go out on recess. If you go back to what Dr. Stack said, if we've got a group of students that stay together, then if one of them gets sick, we're only having to deal with looking and caring for a smaller group, as opposed to if one kid gets sick and they've been intermingling with 250 kids in the high school. So that will come out, and that's the reason for that grouping. That helps us to be able to manage that. And I think maybe Emily will talk later about examples of some pertussis outbreaks, some different things. We've been doing this kind of thing for a lot of years, and so have you, in measles outbreaks, whooping cough, different things like that. The testing Dr. Stack mentioned, we'll see more testing done. The type of test is very important. I don't foresee mass testing being done anytime soon, but I think it may be something that will be offered later in the year. But as Dr. Stack said, it'll just tell you what's happening today. If I had a PCR test today and they'd take the swab and go in the back of my throat and do a test, that means I don't have it today, but I could be an asymptomatic carrier next week and just not realize it. Contact tracing, that's what we really need your help in. You have helped us out with that, with measles outbreaks, with all different kinds of infectious processes, and this just helps us to know who was in the vicinity of that person with the infection, and how do we isolate them so they don't spread it to the entire school. And we've talked about the school. We haven't mentioned the school staff because the kids can pass it to school staff, staff can pass it to the kids. So we've got a whole host of age ranges that we need to be very careful with. And then enforcement and monitoring. We talked about this, that we don't have a COVID police. Nobody's going to come and by with a 6-foot measure and measuring and citing people. We feel like that if we give you the information you need, then you're going to come up with those creative situations to make the best possible things happening for your students. Now, there are regs in place for environmental things, and those haven't changed. There are regs in place for immunizations. There are regs in place for school vaccination, for school physicals. Those are still regulations that are on the books. The emergency order by the governor hasn't changed those. So those will be things that will be expected. But our COVID guidance are things that we're giving you with some science behind it as to why we're recommending that. And these creative solutions will be things that you will come up with. As far as vaccination goes, and Dr. Emily Meserly, who's the branch manager for immunizations, I don't know if she'll be talking about this, but just to let you know, we are already working with CDC in Kentucky and all the states. When that vaccination is ready, we will have a max vaccination plan ready. So we're not going to wait until it's finally approved. We are already ready, and we'll be doing that as soon as it's possible to do. Dr. Stack mentioned the pediatric MIS-C, which was found in New York City. We have had 2 known cases of that in Kentucky. We've investigated several, and we only have 2 under investigation right now. So at the most, we would have 4, but we only have 2 confirmed and 2 under investigation. Very small slices, he said. I just wanted you to know where we were with that. So I think as far as reopening plans, you don't need to submit a plan to the Department for Public Health. I do know that I've been contacted by some health department directors, and your principals, or even maybe some of you superintendents, have contacted the department for the local Department for Public Health in your local health department, and you're already working on submitting some plans and say, hey, what do you think about this? And I think the more eyes you get laid on this plan, I think that it's going to come out on the other end as a better and safer plan for your children and for your students and for your staff. So I'm going to stop talking now and turn this over to Dr. Emily Meserly. Fly on the wall is Jan Bright. She's not going to be talking, but these are 2 school nurses that have put together some ideas for you that we'll go through today, and then will be available for questions unless Tony thinks we need to do that now. So next slide. Go ahead, Dr. Meserly.
Thank you very much. So I'm Emily Meserly. I am a nurse practitioner, and I run the immunization branch here at Kentucky Department for Public Health. In my former life, I was a school nurse. Jan Bright and I worked together, and she helped me come up with this slide set as well. And I also am coming at you all with wearing a couple of other hats. I'm a mother. I have 3 children in 3 different Fayette County public schools. All 3 of them ride the big yellow bus to and from school. So I'm wearing that parent hat too. So your school nurses will end up being a great resource for you all, but we also know that you don't have a nurse in every school. So as Dr. White mentioned, it's very important to identify who, just like Healthy at Work, you identify a COVID-19 resource person. Every school needs to identify who is going to be your COVID-19 officer, so to speak, or your resource person, to make sure that everything is being kept in line. So there are things that school nursing will help with: temperature checks, hand washing, face coverings. I'll get into a little bit more detail with this. What I want to really have all of our guidance be is knowing that the driving force behind all of this guidance is, as Governor Beshear and his team for contact tracing met with you all on the 21st. I watched that presentation this morning, so I know what you all have learned, that everything that we are recommending, and it's CDC-based guidance, is to assist that contact tracing process in the school setting, so that there are minimal number of students that have to be excluded when there is a positive case. That's the whole reason really behind all of this. So things are going to have to get creative. Homerooms while instructors move around the classrooms, staggering recess, making sure that there are distancing methods when students are entering and exiting the facility. And then transportation. As Dr. Stack said, yes, this is very hard, but you cannot fill a bus full of children because they really will spread the disease to each other. Next slide, please. Next slide, please.
It moved. Is it not showing safety actions, minimum requirements?
Not on my end, no.
Okay, hold on.
I can see it. It is showing on my screen.
Oh, okay, so it's showing safety actions, minimum requirements.
I got it now. There. Yeah. Okay.
Sorry.
So these 6 overarching topics are what I'll go into a little bit more. Healthy hygiene, that is not just hand washing, that's also having children cover their cough with their elbow, not with their hand. Promoting social distancing, limiting sharing, checking for signs and symptoms, planning for when a staff member, child, or visitor becomes sick, knowing ahead of time how you'll handle that. And that includes having a sick room for a sick child at the school. And then just maintaining healthy operations. Becky Gillis will really get into a little bit more detail with the cleaning and hygiene. Next slide, please. So hygiene, promoting and modeling hand washing, covering coughs and sneezes, making sure that you're taking regular breaks for hand washing or keeping hand sanitizer within the classroom, posting signs everywhere to remind children. I really like that 3-pronged saying that Governor Beshear has come up with, which is hands, face, and space. I think that's a really, some signage with that, hands, face, and space would be really good for the school settings. So as far as masks, the CDC recommends that all staff, because staff are adults and staff can comply with rules, all staff use a cloth face covering. We are not saying that you need medical grade, but reusable, wash every evening when you get home, cloth face covering. And then in coordination with the childcare guidelines that we gave, children 5 and over should wear a cloth face mask, which would basically mean from the kindergarten level up. We understand that in the preschool setting, in those toddlers, it would be a day-long battle to get them to wear the mask all day. And they're very essential when physical distancing is difficult. Like, for instance, when you're lining up to go to, when a classroom is lining up to go to the bathroom, in the hallway, or at dismissal times. So those are really key times for the face coverings. Next slide, please. So social distancing, again, this is restricting, mixing, and promoting static groups, as in having a true homeroom model is the way that you can have the least number of students and staff excluded when there is a positive case. If any of you all have experienced in your schools a breakout of whooping cough or pertussis, I had that happen at a large middle school. It's really difficult to do the contact tracing in a middle school or a high school setting using its normal day-to-day operations. There could be so many contacts from the bus to the hallway to extracurriculars to choir, band, all of those things. So really changing the way we look at school to accommodate that contact tracing is the overarching message that we want to get across today. So desks 6 feet apart, serve lunch in the classroom. When you open up the cafeteria, again, that contact tracing gets very difficult. But if students eat with the core group, the contact tracing is more possible. Communal settings, we just put playground equipment. You know, currently parks are still closed. Playground equipment is something that, you know, it's a surface, it's a frequent touch surface. So children can still go out and play, but it's that playground equipment that really can spread disease easily. I said meals in classrooms, limit numbers on buses. This really is a non-negotiable, and the limiting children on the buses is what will also limit how many children will be in school each day. So that the two really go hand in hand. Next slide, please. So this really more is for elementary schools, the limit sharing. At the junior high, the middle school, and the high school level, students and teachers can really, keep things to themselves. It's more in that elementary and preschool age that trying to limit sharing of supplies or making sure that they're being disinfected after sharing. Electronics, toys, books, it's a lot. But just knowing that there should be hygiene in between students and just minimizing the sharing. And keeping things in a cubby or a labeled container. That way they're not bringing the germs from home and spreading them to other children on things like their backpack, which is unlikely, but just keeping them separated as well. Next slide, please. So planning for staff and student illness is really important. Knowing what your plans are. You want to work with the school nurse, the school health staff for when someone in the building is ill. And I actually did not, that will come next, check for symptoms. If you don't have one currently, it's more important now with COVID-19 to actually have a true sick room. So if a child gets sick with a fever at school, they can be isolated until their parent comes to pick them up. Now, that doesn't mean grouping sick children together because one of them might have COVID, one of them might have an ear infection that's causing the fever. So you really need to just isolate a child who has a fever. So having that procedure to safely send the child home is important. Next slide, please. Did we skip check for symptoms? Was that not on there? Okay, Dr. White might have removed that. That was
Accident.
Oh, so that's okay. So there is the last thing should be check for symptoms. So that means that no different than the healthy at work guidelines, because school is, I always tell my children, school, mom goes to work every day, but school is your job as a child. That is your job. So we're treating the schools no differently than work. When I come into work every day here at Kentucky Department for Public Health, we do temperature checks. We do a symptom check. And that will need to be done each day. And what we've discussed is that the start of the school day for many children is actually when they get on the bus. So the recommendation is that a child have their symptoms and their temperature checked as they get on the bus. Otherwise, you could be bringing an ill child or a child with a temperature to the school. And the very last thing I want to say is that when you do find out that you have a positive COVID case, the first thing that you do is you notify and be in close communication with your local health department. That is, they are your communication point, and they will then institute this contact tracing procedure that the governor and Mark Carter discussed with you all at the meeting last week. So that contact tracing will get taken over. And if you saw that model of the contact tracing, the more grouping you can do with your students so that they are staying with the same group of students throughout the day, the better the contact tracing can be done and the minimum number of people would have to be excluded from a school. So thank you very much, and I will stay online for questions. I think next we have Becky Gillis, who has been running our Emergency Operations Center. She's the Director of Preparedness, and she's going to talk about environmental hygiene, how to work with your environment in your schools. Thank you.
Thank you, Emily. Next slide, please. So yes, I'm Rebecca Gillis. I'm the Director of Public Health Protection and Safety. So the division that this division has the environmental health programs and also serves as the lead for working with emergency management coordinating health and medical response for any kind of disaster. So we have been, several of my staff and I have been over at the Emergency Operations Center for several weeks now. But today I'm going to talk a little bit about maintaining that healthy environment. So when we talk about reopening schools, that daily cleaning and disinfection of all school facilities is really important. So I'm just going to spend just a few minutes talking through some of the highlights of that. So that daily cleaning and disinfection is important, and that would be, classrooms, gymnasiums, restrooms, locker rooms, cafeteria, seating, desk. It's critical to preventing the spread of illness. So we should pay special attention to those high-touch areas, such as water fountains, doorknobs, light switches, desks, computers, phones, sinks, handrails, etc. So we'd recommend at least daily and as frequently as possible cleaning, especially for those high-touch surfaces. If the surfaces are dirty, we'd recommend that they be cleaned using a detergent or a soap and water prior to disinfection. And then for disinfection, you could use a diluted household bleach solution or alcohol solutions with at least 70% alcohol. And most common EPA registered disinfectants should also be effective. I recommend that if you're using those different products, follow the manufacturer's instructions for application and proper ventilation when using those. For the soft or porous surfaces, like rugs, I recommend that you just remove rugs if possible. For other floors like carpets or drapes, the recommendation is that you remove any visible contamination if present, and then clean with the appropriate cleaners indicated for these surfaces. Also wanted to touch on ventilation systems. You want to ensure that your ventilation systems operate properly so that you're increasing the circulation of outdoor air as much as possible. For example, by opening doors and windows. Of course, we don't want to open doors and windows if that poses a safety or health risk for children using that facility. When we're talking about using those cleaning supplies and any toxic items, of course, we always want to make sure that they're stored appropriately and kept out of the reach of children, as that can be a safety hazard. And looking at your water fountains, again, recommend that they be cleaned and sanitized frequently throughout the day, as this is a high contact area. And as much as possible, we should encourage students to bring their own water bottles to be refilled throughout the day so that students aren't directly drinking from those water fountains. I also want to touch on school buses. Again, the surfaces of school buses that are high contact areas such as handrails, seats, windows should be cleaned and disinfected after each bus route and as often as possible. Also want to mention ventilation of buses as well, especially after the bus route has been completed, by opening those doors and windows. And I want to mention, if there's an interest, Dr. White had talked about potentially partnering with education and the school attendants to offer some continuing training and updates for those school health and district health personnel. Wanted to offer the possibility of doing a specific training that might include those folks and also local health department environmental professionals to specifically look at ventilation issues in the schools and maybe on the school buses as well, if you think that would be helpful. Lastly, I wanted to touch on cafeterias and feeding in the school. I think Emily had mentioned this, but it's recommended that students eat eat in their classroom. Children should have their own meals or be served individually plated meals in the classroom instead of using a communal dining area. Of course, we should ensure the safety of children with allergies as well when we think about feeding. I'm going to turn it back over now to Dr. White. There's our contact information up on the screen. Feel free to reach out if I can be of help to you.
And this is Connie. So we'll connect with Angie McDonald and offer any help that we can with any trainings ongoing with any of your Department of Education staff. Questions?
So Tony will take us through questions again. For the attendees, you can submit a question using Go Soapbox, and can we flash that slide up, or is that possible? I think everyone knows it now. KDE COVID is the code word or the password, and we have about 55 minutes left in the webcast. We do have 2 other topics, but we are going to defer those if we need the full 55 minutes to have questions. We know it's very important. Obviously, all the items on our webcast are important, but we have public health here, and they are obviously going to be listening to your questions and concerns, and then they will be taking that back for further discussions with the department and with folks in their office as we continue to hone and refine this guidance. And we ask them, and they will also be back with us, at least one representative, if not the ones here today, for our webcast next week. And we, of course, I'm sure we'll have them on several more times between now and the fall. So just want superintendents to know that please keep those questions coming in, and then of course we're going to have them here next week to continue talking about this. So Tony, turn it over to you for questions.
Okay, so going back to the questions that were not already asked and addressed, I'm going down the lunch here. In terms of having students that are sitting together on buses or together, could students from the same family sit together? And a yes or no on that one, I guess, is what they're looking for. Or would that be allowed?
I would think if they're in the same family, they're already staying together in the same home. Yes, that a family unit like that could stay together on the bus.
Another question is are these going to be recommendations or are they going to be mandates? So recommendations or mandates? I
like to look at it as guidance. This is the guidance of what the science tells us, but that very first slide that I said, you have to look at feasibility, accessibility, and you have to tailor that to your particular community. The closer you can get to these, the less likely there will be issues. Will we have COVID-19 after today if everybody did all of this? Absolutely. But what we're trying to do is harm reduction. It reduces much harm that would be possible from a student coming into your community and into your school community and causing infection to be spread by folks. So the more you can do as many of these things as you can, this will not be something that your school will say, we had 15 people that had COVID-19. So is it mandates? I don't think the Department for Public Health can mandate anything to the Department of Education, but we can tell you these are the guidelines and try to give you good science to back it up as you try to come up with creative solutions to make these things happen.
And if I could interject, Dr. White, I think what everyone's saying, the governor, the Department of Public Health, KDE, the state board, is that everyone needs to act in good faith. Local school districts are state actors, even though they are locally controlled. They are arms of the state. Mm-hmm. And I think we all want to act in good faith. And we don't want to have a situation where these practices are not followed, where the local health department does have to come in and shut down a certain entity because there is some type of an outbreak. So that's what we're trying to prevent.
It's kind of like with flu. I mean, sometimes things happen in the community and a school does close because there's so many people sick that they have to close the school down. And we're trying to give you as many different ways as we can keep that from happening in your school.
Okay, there's a question about the kind of sanitizer or the it just got moved. Sorry. Okay, here we're getting conflicting guidance on the type of hand sanitizer that should be purchased for safe use by our students, but yet strong enough to combat COVID-19. And I think I heard one of you all reference that in the PowerPoint, and they were just wanting some clarification on that. So the type of hand sanitizer that they should be purchasing for combating COVID-19.
Do you want me to take that, Dr. White?
Please.
Hand sanitizer containing at least 60% alcohol may be used when soap and water is not readily available. That's the recommendation from the CDC.
And I think, Becky, you mentioned if you were cleaning a surface, that was a 70% alcohol.
That's 70%, yes.
So there's two different things you're cleaning, hands versus a tabletop.
Yes.
There's a question at the high school level. They're wondering what the recommendations are on changing classes, because the space obviously can get, there's a lot of tight space involved with changing classes, and want to know what the recommendations or advice would be on that.
Can I take this one, Connie? I have 2 children in high school.
Right, yes.
Yeah. So my daughter, who goes to Dunbar, asked me exactly this. Hey, Mom, how do we social distance when we're changing classes in the hallway? So if you look at the guidance document, I think that KDE sent out, as well as CDC's guidelines, if you allow normal high school class changes to occur, you end up having almost a contact tracing nightmare, meaning that knowing who was exposed to who becomes really difficult. I think high schools promote or have the opportunity to do a hybrid type model where sometimes you're at school and sometimes you're at home. High schools are much larger than elementaries and middle schools. So using a hybrid of NTI and in-person to keep that social distancing, that 6 feet apart, is really, and having the teachers move around is really what is the guidance is. So the teachers move around rather than the students, and the students have, and I would urge you, because my daughter said, again, Mom, how are we going to do that? And I said, you know what? You need to offer up to Betsy Raines, the principal at your high school, to be on a small committee. So each district or even each school can sit with the SBDM and come up with a model that works for your community and your building to minimize the contact between students. You really have to get creative. I know Becky Gillis said that she has reached out to some folks or maybe they reached out to her, some folks at EKU who are involved in industrial hygiene. So getting partners together to come into your school and map out a plan, or come into your district and map out a plan for how your building can accommodate social distancing and less mixing of students is really what's your homework for the summer.
And wearing a mask.
Yes, and wearing a mask, not just social distancing, but wearing a mask, yes.
So if we group students and have teachers move rooms instead, won't the teacher just become a carrier to all of those groups anyways, is what the next question is.
So, Dr. White?
I would think that you would have a better control over the contact that your staff has with the students, as opposed to trying to get students to socially distance. So if your teachers are doing that 6 foot of social distancing and wearing their mask, then they're less likely to transmit that to a small classroom, as if you've got students who are interacting with each other, passing in the hallways. I think, again, unless we put everybody in a bubble, the risk is not going to be zero. So we, again, harm reduction. How much can we do to try? And that's what these different ideas are, is to try. What can we do to try? So when we have cases, we can step back and say, wow, even though we had a case, we thought of everything we could think of, and we tried to do everything that would possibly keep one of our children from getting sick, our staff.
And again, for contact tracing, keeping track of a staff's schedule versus a student's schedule is much more feasible. There's not that so much intermixing and commingling. And when a contact tracer calls someone with a positive case, when you notify your health department, it's kind of like, in Hansel and Gretel, when you're leaving the trail of crumbs, it's going to be much easier to follow the trail of crumbs of a teacher moving around rather than a whole classroom or a whole high school. It's, again, that's what harm reduction is. So.
The next question is, there's an issue about how they're expected, along those same lines, is how they're expected to keep a teacher with one group of students for possibly an entire day to keep them from spreading the virus, when middle and high school teachers are only certified in one subject.
Right. So I think that goes back to, if I'm a teacher and I go to 5 different classrooms in a day, I'm going to be 6 feet away from the students. And so if one of those students, or if I'm positive, then I have all of those classrooms I've been in, those students are at low risk, as opposed to students who are, even if they're sitting 6 feet apart, they're going to be together, passing in the hallway. That just increases the number of opportunities that people will become high risk, because there'll be closer contact, as opposed to me, the teacher, who comes into the room for 40, 50 minutes, 6 feet away from you, and moves on somewhere else. So it decreases the number of people not exposed at all, but the number of people who are exposed at the moderate or high risk level. And those are the ones that will be contact tracing. Those are the ones that will be at risk for catching the COVID-19 infection. It's a violently infectious. It's nothing like the flu. It is so easily contagious. It's hard to even put your head around it.
So we have go ahead. Go ahead.
It's going to be important to think about, as you look at class schedules, trying to group students who have similar schedules to where they can be grouped for long periods of time. With middle and high school, where you start getting into students branching out to specialty core classes, you're going to have to make sure that, now it isn't so much an ABCD grouping, it's more of this person's going to have advanced English, they're all going to be in algebra, they're all going to have similar type classes, so they can be grouped in one core group that teachers come to, versus them moving through the hallways in multiple places.
And don't also discount the use of technology in the school, meaning that if those special area teachers aren't comfortable hopping around from class to class, they can get on, a smart board and do a presentation to that class. So we have to be creative with that too.
And then using technology helps if you have a distance learner. If you have that child who is at risk and can't come to the school building, but they'll still be participating at the same rate, just at a distance.
Right.
So the next, and the other issue is, and this is brought up by a superintendent that is talking about the high school level. There's a lot of students in high school, they're not in the same classes. And so they can't just change teachers, and they can't ask teachers to teach double classes. So, one in person and one virtual. So they're kind of at that point where they don't know what to do, because all the scheduling has been done, and you can't just, one student might be in a class for a period, but the next class they're in a different period. So what is the distance students have to stay away from each other if they are wearing masks, is the question.
Well, the mask greatly decreases that chance of infectivity. It doesn't make it zero. So If you're 6 feet apart, your risk is lower. If you're wearing a mask, it's even lower. Again, we're giving you the ideal settings and the ideal situations, and you're going to have to look at your individual school schedule, your individual students, your physical property. All of those things are going to have to be considered. And I think that that Commissioner Brown said it best. We're looking for people to do the best that they can, and feel like that they're being very genuine about, we're going to make this the best that we can make it. And everybody doesn't have an ideal physical setting to do this, an ideal set of students that all have similar interests that you can group, or you don't have all the teachers that you want. You never have. So how can you make this as close to the things that we're telling you as possible for your setting?
Right. And then to follow up with that is another question, is that they said they're really not trying to put roadblocks up, but they're just not sure how a static class could work at the high school level with the teachers rotating through classes, because there's just too many different classes that the students belong to and not enough teachers that are certified to teach in that particular subject area, which is required by law, et cetera. So there's a lot of conflicts in terms of scheduling. And so they're just not really sure how that's going to work at the high school level. So I don't know if it's just a comment there. It's been brought up high at the list.
Absolutely. I tell people around here, all you can do is all you can do. And you take what you've got and you make it work the best that you can, knowing the more things you can do, the lower your students and staff are going to be at risk. You do the most and the best things that you can do with these ideas in mind in the back of your head as you're planning. And I know a lot of plans are in place, and if you come up with an aha moment and go, oh man, we could have done this instead, well, take the time to see if you can try to make that change. I know it's cutting it close, but don't stop your creativity just because you've got your schedule in place. Think of things you can do. Think of things that you can alter. Anything that you can do to lower the students and your staff risk is all anybody can ask of you.
I just have one. Okay. I have one comment. This is Emily Meserly. That what's really important to do now, especially with tomorrow being the last day of school, before you sort of lose that audience of parents and students. Get feedback from your families and your students on what they think is feasible. You may get a lot of feedback from parents in your district saying, you know what, I don't care what plan you come up with, I'm not going to send my child to school in the fall. And so, but what I mean is they will self-select, and then more people will stay home and do NTI, and that will sort of thin out the crowd, so to speak. So that's I know that's the opt-in option that was proposed. So that's something else to think about.
We only have 2 districts, and they happen to be our 2 largest districts that are still in right now. So that's the other issue. The rest of the 170 of our districts are already done. So
okay.
It's just Jefferson and Fayette that I believe are still in. The next question is, should the districts purchase masks for everyone, or can we require everyone to bring their own? And then followed up with that is the concern that the kids will not bring the masks back the next day. So then do you just keep supplying them with new masks and that whole issue?
And that's the $1 billion question, I think, when you talk about masks. You're going to have buses with capacity for a mask per child in order for them to have it. There will always be the responsible family, responsible child who will bring in and provide that cloth mask and change it up. But then there will also be those students where you literally will have to provide it every single day. There's no magic answer for that one. But it can be a cloth mask. It's a good time to work on community engagement, seeing if you've got quilting clubs and those kinds of things who can make them and donate them to the school over this summer and prepare for that to help save some of the expense at the school level. But the big thing is making sure you have one that fits properly, and then providing that education and modeling so that it stays in place when staff and students are wearing it.
Okay. If a student tests positive, will the entire quote unquote homeroom need to go on a 14-day quarantine? And similar question is, if a student tests positive, will other students be required to quarantine, thus shutting schools down again? So 2 questions, similar focus.
And again, as y'all learn in the contact tracing webinar, it depends on how much contact there is. It depends on how much the classroom is spread out. It depends on how much that student has traveled around and how many classes they've been in and been in close contact with someone. Like I said, just because they've been in the building doesn't mean they had close contact. They would be low risk. They would be allowed to continue to go to school. So it would involve how much close contact and how long a period of time they were together. So that's why the smaller the groups that the kids are in, the fewer kids that would have to go into a quarantine setting.
Okay. The next question is, for the health experts, will there be rules, quote, rules or specific guidance for making the determination about sending students home for COVID-related symptoms? Just temperature? They cannot discriminate. Is there concern there?
I'll let the school nurses talk that one through.
So yes, we will have in our written guidance based on CDC guidelines, so there are current communicable disease guidelines for school nurses of when to send a child home. And actually just about everything that's a symptom of COVID is something that you would already send a child home with. Fever, diarrhea, rash, fever and cough. So yes, but we'll make sure to spell it out clearly, but it really shouldn't be any different than what you currently send students home for.
Do the masks need to be washed daily?
That's certainly recommended, yes.
Yes.
And it's best if they're dry. So putting a wet mask on a child is not going to be favorable.
Okay, another question about masks. Masks can interfere with school safety due to covering the face. Is there any guidance regarding masking and school safety?
Well, every time we've mentioned mask, anything that's come out of the governor's office, they have a blanket statement about masks, and then there's always the sentence that says, if this is going to interfere with safety or the health of someone. So you don't want to put it on someone with bad asthma. There's a whole host of medical conditions that children wouldn't be able to wear it for, and certainly if it's going to interfere with their vision, you don't want to, I think, be running sprints in 103-degree weather, trying to wear a mask. So again, this is the best you can do to figure out what is not going to impair the child's safety, but how can you use the mask to keep the child safe?
And if it's a question of identity, having a policy, as I know already middle and high schools do, but of wearing, the ID badge with a picture, then you know who that person is. I think that was one of the concerns, is that they wouldn't know who the children were. So that might be something to instill in the elementary level, to have name tags with their picture so that the teacher can see, gets to recognize the children.
Our next question is, who is the authority on schools reopening? The Department of Public Health or the local school board?
I would punt that one to Commissioner Brown.
Well,
or is it the governor?
So I don't want to get way down into the weeds on a legal issue. I hope we're all still operating here in good faith, knowing that we're all trying to protect the citizens of the Commonwealth. So if the person asking that question desires an answer, we will certainly get them the legal answer to that. But obviously school districts control, and local school boards the local school district. However, districts are state actors. And so the expectation is state actors are going to also be working in tandem with other state agencies not only the Department of Education, but also the Department of Public Health during a global health pandemic. So if we get to the point where there's conflict between those things, then we can certainly look into the legal aspect of it. Todd, do you have any further comments on that?
Commissioner Brown, I agree with you. As it stands right now, it is my understanding is, the authority to designate a school calendar and determine when school is going to come back into place rests with local school boards. We've provided flexibility to local school boards to allow them some additional time to get those calendars together and get to us. However, state law provides authority to the Commissioner of Education to have control of all of the common schools in the state if he needs to step in to take some action. And there's also some authority with the Department of Public Health to step in and take some action in the event of some type of, infectious disease in order to control that. So right now, we're relying upon local school boards to exercise their authority to set forth a calendar that works for their community in the best way possible to help prevent the spread of COVID-19, knowing that if we get into a situation where in a certain community or in a certain school that spread is increasing due to practices that are not advisable, then there may be authority for both the department and the Department of Education and the Department of Public Health to step in and take some action.
And I would just add, thank you, Todd, for that. I've been very proud of Kentucky in that, we closed all of our schools within about, 48 hours notice. Maybe it was up to 72 for 2 additional ones. As a result of everybody coming together to do the right thing, the governor didn't issue an order closing the schools. He conducted a conference call to recommend the closure of the schools, and the schools closed, and so did the private schools that fell right in with that same recommendation. And to me, that, as I said before, that's a testament to Kentucky and what I consider what I call the Kentucky education family. So I don't think we're going to have to get down into the legal weeds as we go through here, but I know that question is probably also on the minds of others, so I appreciate the question. But my expectation and my belief is that we'll all continue acting together to try to do the best thing, acting in good faith, as both local units, operating schools, taking the advice and counsel and recommendations from the experts at the state level as well.
Okay. The next question that we have for the health department, or just on this particular question, sorry, it just got moved up, is it kind of relates back to safety, but not necessarily on masking, just talking about having on the safe schools laws to have like John Akers weigh in on some of these recommendations, because open doors for ventilation safe schools requires doors should be closed and locked. So they're just wondering how that possible conflict would play out in terms of what recommendations would suffice in regards to this, I guess.
And I would also add to that we do have John and his team at the Kentucky Center for School Safety working on a whole laundry list of issues. And John, you don't know this yet. We just added another one today based on today's call. And also Mr. Ben Wilcox, the school safety marshal, they are looking at things like this. And then, of course, if there is conflicting information in what public health is issuing and then what exists in other recommendations or in other parts of school safety regulations, we'll work to synthesize those. And John, the one thing we thought we would need some expertise on that was mentioned today is the mapping of schools for social distancing purposes, guidelines, that your expertise could come in handy working with public health to issue that. So Dr. Foster is going to be reaching out to you to talk about adding these 2 things that were just mentioned.
Another question is, are any of these guidelines being shared and developed, being vetted for realistic expectations by classroom teachers and administrators?
So I would say, so from public health, again, we give the guidance, but how each district implements our guidance, absolutely you need to have multiple stakeholders at the table: parents, teachers, staff, principals, custodial staff. Bring in a team to come up with your district plan or your specific school plan.
And that what is described there by Dr. Meserly is that information on how to do that and those questions to ask your community. That was in the first documentation that we issued as a department, but that documentation also had input from public health. That was a little bit more education-based guidance. The next set of guidance is going to be a little more public health-based. KDE, we have at least weekly meetings with public health, weighing into them, bringing up issues that maybe public health hasn't thought of, and then vice versa, issues that we haven't thought of from a school setting. So that conversation is ongoing as we continue to try to refine and hone this guidance.
And we have invited some community voices from school nurses. The president of KSNA, we've invited different community level people to provide their input as well about feasibility and reasonableness.
So another kind of a question, they're wondering if are we not setting ourselves up for lawsuits with everybody doing different things? Is their question.
Well, Todd, you can weigh into this, but as a school district, you're running one of the riskiest operations in your county. You're the largest employer. You run in most places, you run the largest food service operation. You have minors in your care, all for the better part of the day, including extracurricular activities, and you run the largest transportation operation in most of your communities. So I'm not saying that to say that this is not a concern. But you will get sued over something. You'll get sued over FAPE. You'll get sued over. There will be lawsuits. There's talk, I believe, in Congress over some liability exclusions for certain organizations related to COVID. We're working on checking on where that is. Todd, do you have any further comments from the legal side?
Sure. Of course, I can't offer you legal advice. You have to speak with your local board council on that. But I would note, just as Commissioner Brown indicated, school districts get sued every day. They were being sued for matters that were, frivolous prior to COVID-19, and they will continue to be so after COVID-19. I think that, in the typical, we don't have any facts, but just generally speaking, in the typical setting, when a school district is sued for some type of negligence issue, the standard is reasonableness. What did they do? Did they act reasonable in the situation, or did they not act reasonable in the situation? So we're providing guidance both from the Department of Public Health and from the Department of Education out to school districts that they can use in their communities to make reasonable decisions. And in the event that they are sued, they can show the court system to the best of their ability that they acted reasonable under the circumstances that they were faced with. That's really the standard. And I recommend that everybody, communicate with your board council on that matter.
I'm not sure where OBGYN fits in with schools being sued, but I know in the 20 years before I came here, in my world, it was a high risk. And when I first started practicing in Frankfurt, I practiced for 20 years. One of the, and I'll call him one of the older physicians because he's not on this call, but one of the older physicians in the community pulled me aside and he said, Connie, always remember, you want to be sued for doing the right thing, not for doing the wrong thing. So I think that goes right along with what Mr. Allen is saying. You go into that courtroom and you say, we took guidance, we did the best thing we could do, we tried as hard as we could to protect our staff and students, and this was the best that we could do. That stead puts you in high stead.
Okay. Going back to buses, they want to know if you have specific guidance for the number of students it is safe to put on a bus.
Well, I think it depends on the size of the bus. And again, it's how much can you spread them out to keep them from having transmission, because we know it spreads through talking, laughing, singing, shouting. The closer they are together, the higher the chance that they're going to, if they have the virus, spread it to other students on that bus. So the most you can spread them out, if they can wear masks, that's even better. As Dr. Mesley was saying, when they're passing each other in the hallway, you standing in line to whatever time they're closer together than you would like them to be, they really need to be wearing a mask if that's at all humanly possible. That's just kind of like belt and suspenders. You keep them apart, you wear a mask, you're less likely to have a spread. You can't get them to wear a mask, then you keep them 6 feet apart. Can't have them 6 feet apart, they wear a mask. I mean, I wish I could give you a number. There just isn't one. It's how can you make this happen safely in your community?
So there's another, this is more for the commissioner, and this is a consensus. I'm trying to put all of these questions into one amongst several superintendents, and it just says it's easy for someone that has not been in school to make recommendations, but if this is the guidance, we simply cannot have school in the fall. Would it not be better now to go ahead and plan for NTI instruction for this fall?
We've been very clear that you need to have a playbook in place, and that playbook includes NTI instructions. The play that you send to the department is your schedule for next year that probably will not be a reality. It probably will not look, the schedule you send to us on July 31st will probably not come to fruition exactly as you have it planned in the first semester, at least the first semester. And that's okay. What we want you to have is a playbook of how you can pivot quickly and efficiently to other methods and other hybrid approaches. And we're working at the department to determine how we can facilitate these approaches. One of the examples that was given was surveying, and this goes in line to what I think Dr. Meserly was saying. We have a district that came up with an idea that now I think a lot of districts are using. They're going to survey their parents in late July and August. They're going to find out how many parents are not going to be sending their kids to a public school environment because of fear, because the grandma that the child lives with has a compromised immune system, and they're going to then turn around and provide remote instruction for those students while other students are learning in the classroom. At the same time, there may be kids that they're going to have to rotate through on a rotational basis, as described earlier in one of the plans as well, using NTI instruction for the days that those kids are not in school. And so all of those types of things we're asking districts to plan for. We're asking you to get community input. One of the recommendations in the guidance we issued about 10 days ago was talking about you need to have a district health representative on your on that committee, and obviously very good contact with your local health department. If not, sitting on advising that committee is preferable. So I don't believe that I do believe we can do this. I believe it's going to be a heavy lift. But I'm already hearing a lot of just sitting here. I got a text from a superintendent talking about how they're going to record teachers' lectures and put that on the Google learning platform, and then have students listen at their own pace in the classroom with headphones on, so they don't disturb one another. You know, they're already working through these types of plans. And yes, it's easy for me sitting here to say this when you all are there on the front lines. Trying to come up with these plans. So I do, and we've heard the governor talk about, and Dr. Stack, the potential for a fall spike. We don't know whether that will occur or not. Dr. Stack said at the very beginning of the webcast, we still need a little bit more trend data to help us guide or help us to know where this might be going. And that was one of the reasons, and it's turned out to be somewhat controversial in your communities, and I apologize for that, but we recommended that you consider an early start date. And in some ways, I know that's can cause more concern and anxiety in your communities, but the reason for that was if your community thought you were ready for that and you could get a few days in an early start date, if there were a fall spike, that would benefit you. If you don't think your community is ready or is once an late July or even a very early August start date, you don't have to do an early start date. That's one reason why this working together in a committee in your school district and getting feedback from your community is very appropriate. So it's not going to be a one-size-fits-all solution. However, there are solutions going on in other parts of the state and in your neighbors that we want to make sure we're sharing out, because and around the country. For example, we continue to be involved with Council of Chief State School Officers and the SREB. SREB is issuing a playbook on school reopening that we have heavily been involved with and have influenced. And so every school district in the country, they are dealing with the exact same issues that we're talking about today. In some ways, that's comforting. In other ways, that's also very alarming. So I think as we move through the summer, and in particularly as we know, as Dr. Stack said, a little bit more in June, we will have a little bit of more firmer footing on what the fall looks like. But to sum up, I believe we need to be making preparation. There is a potential we may have to be in NTI instruction next semester. We don't want that, and we certainly don't want to open schools with NTI, the first day being a virtual or a remote instruction. But I do believe we need to continue refining that and making plans in case that has to be the eventual outcome.
All right. The follow-up question, they said they really need an answer to the question, quote, who gets quarantined when a student tests positive, not, quote, depending on how close they are, quote, end quote, which wasn't addressed the other day as well as in contact tracing webinar that they've been part of. So they just need like kind of a clarification as to who gets quarantined and not based on how close they are or were.
So in that webinar, I do recall that Mark came up, said he would share those plans, those contact tracing plans with you all when he had them. So we'll follow up with him to make sure, because they are going to have specific contact tracing guidelines, of who's considered a close contact, who's not a close contact. And we'll follow up with him to make sure that those get shared.
And this all goes back. Oh, go ahead, Commissioner.
No, go ahead, Dr. White.
Well, again, go back to why we're doing this. If I am around someone for a very short period of time at a far distance and I'm in the same room with them for a few minutes, my risk of catching this illness is very low. So it wouldn't make any sense to put me into quarantine. I will be told I'm a low risk because I've been around someone with COVID-19 and I need to especially watch my temperature and watch for symptoms and report them right away. That would be what the contact tracer would tell me. However, if I have been around that person that's where the period of time comes in. How close was I for how long? The longer I was close to that person, the higher my risk of being infected with this virus goes up. So it's those people on that high end are the ones that we're going to say, you need to stay home for 14 days because there is a likelihood you were exposed to this virus. That means there's a likelihood that you will either have symptoms or may not have symptoms. But if you have been infected with this virus, you're going to spread it to other people. As Dr. Stack said, one person spreads to an average of 3 people. So if you've got a classroom of 14 kids, that's fantasy. You never have a classroom of 14 kids. You've got 32 kids, and one of them gets sick. That's 31 kids are going to spread it to 3 people. And then those 3 people, if I do my math right, that's 93 people. And then those 93 people will spread to 3 people. So the numbers go up very quickly. So that's why the person with the illness, person with the viral infection, you bring everyone that was close to them for a period of time and a close connection physically, spacing wise. You make sure those people don't go out and infect other people. That's what's going to keep it contained and not be spreading in your community. So that's why the distance and the amount of time, that's what determines whether you're quarantined or not.
Tony, unless you had a follow-up to that one, I wanted to interject something on NTI.
Well, yeah, there's one quick follow-up on that one that I thought was a good follow-up, and they were just, a question is, are the schools or the health departments responsible for the contact tracing? And if the health department is responsible, will the schools be notified or asked to provide lists of students who the student came in contact with? And they put in parentheses like primary students.
Absolutely. Part of contact tracing is the health department is notified of who we call the index case is, the person with the infection. They will know who that person is because of their positive test. They'll talk to that person and find out who their other contacts were. But then they, as in any business, Healthy at Work, they will contact the workplace, which in this instance is the school, so that way the school can give that information just as they would if it was a measles or a whooping cough outbreak, as they've done in the past.
And there are already protocols in place for communicable disease, for contact tracing, for things like pertussis and measles, where schools, if they're worried about FERPA, where schools are allowed to share that information with public health.
Kevin, did you want to get on NTI? Because I do have several questions on NTI, and there's also several questions. I don't know if you want to go a little bit longer on athletics. There's a huge interest in what they're supposed to do with athletics, and some despair about that and extracurricular activities.
Obviously we're going to, we will, I don't know how long the public health folks can stay on. It's usually not very beneficial to go past 10 or 15 minutes because we start losing our audience as well. So, I don't want to go past 4:05 or 4:10. We obviously are going to defer the other two agenda items for the webcast till next week. But we will continue on with questions for about 10 or 15 more minutes that are related to public health. This was not really related to public health, but this is an NTI question that came up from a superintendent just now to me that was raised in a response to something. So many of you have asked whether or not the availability of NTI days will be beyond the 10 that you have in statute, because the extension that you received this semester was because of Senate Bill 177 and that authority given to the commissioner. I feel 100% certain you're going to get that, but in order, some of you are anxious about relying on the word of me or the department, so we are going to be asking the Lieutenant Governor, who, as the Cabinet Secretary, to implement an executive order, much like we did for the civics requirement test, which took an executive order since that was statutory. We're going to provide that NTI flexibility over the summer, so you know that you have it, which is going to be basically an unlimited amount of NTI days for the following school year as granted by the commissioner. We hope to have that signed off on, and you can rely on that by mid-June. We are also working on other matters related to how you might count students who are in the hybrid models that we keep talking about. A student who is sitting at home but is learning from your school district, but they are not on home hospital. They are less than home hospital, meaning they don't have that documentation, and they're not going to need to have it under the model that you all are proposing, and that we are going to give you the flexibility to be able to do that, hopefully through some revised definitions of attendance. So I want to go ahead and put that out there. I know that's on your mind. It was certainly on the mind of this superintendent that just texted me. So we'll be talking more about that, of course, as the weeks go on. Tony, you can continue on with the questions.
Okay, this question was kind of with the quote, and the quote was on non-negotiable on busing. When will KDE provide some clear guidance on funding impact in order for districts to make plans, both financially and operationally?
And I think the non-negotiable part of that, let me just jump in there, is the most distancing you can possibly have happen. That's going to decrease your risks.
Sorry, muted myself. As a follow-up, I think that they're wondering, how will their current funding be adjusted to accommodate those recommendations? Because I believe within those recommendations, there was talk about a bus monitor to make sure that the bus driver isn't watching, the kids are not getting up and walking around. And so I think that their concern, again, I'm trying to summarize several questions here, is how will current funding be, how will their current funding be adjusted to accommodate recommendations? And I think that's more for the department, for us on the Department of Ed to answer in terms of support.
That's correct. That has obviously a transportation. Well, it impacts everything. This hybrid model we're talking about, it's not contemplated really under the current statutes. We have some statutory allowance for competency-based education. But in the NTI envisions everybody's out of school, not half of the students are out of school. So we're working on, again, giving some executive order relief through the governor's emergency power, since the General Assembly will not be able to function on this until at the very earliest January. So all of those things are under consideration because we know it's going to affect you in different ways.
All right, the next question kind of relates, and I mentioned that there were several questions about the athletics. They said the National Sport Association and KHSAA has basically put all districts in an undetermined dead period. And so they're just not really sure. Right next to it is another question. Public schools cannot make all of this happen. I know it's important, but it's impossible to open. Athletics are extracurricular, which sounds like a no-no. So they're just not really sure what they're supposed to do with athletics, extracurriculars, anything along those lines.
We probably need to have Commissioner Tackett on the next webcast next week. I know I've been reading about the updates from KHSAA and the 2 meetings that were held last week. And I know there's been some confusion due to the youth sports announcement and then how that might impact or influence use of facilities or other sports that are regulated by KHSAA. So I don't think we have the person or the time on the call today to answer that question, but if I'm sure Commissioner Tackett would be willing, and I know he has his other venues as well, but we'll ask him to be on the webcast a week from today.
These 2 questions kind of go together, so just give me a second because one's at the bottom and one's been put up to the top. How is lunch in the classroom going to work when it is a law that teachers get a duty-free lunch? And then somebody has actually cited that law, KRS 1580.060, duty-free lunch for teachers. They say that will need to be amended if they allow them to have lunch in the classroom or along those lines.
We are aware of that, of course, and it's been in our laws in Kentucky for quite a long time. Obviously, respect what it does, and it is necessary. However, we are in an emergency pandemic situation, and so we will obviously be looking at ways that we can satisfy the law and or have other alterations temporarily to facilitate public health requirements through. So I don't have an answer to how that's going to be solved other than knowing it's on our radar. Todd, do you have anything else on that?
No, I don't have anything else. I would consider just or mention from a practical standpoint. I think public health has advised that lunch be conducted in the classroom, but it doesn't necessarily have to be supervised by the teacher during that time. So there is a possibility for the district to attempt to rotate other staff into the room to supervise students while the teacher received a lunch break. We realize there are logistical issues with that occurring, but some level of that is certainly a possibility.
Okay. There's a question, can KDE create a health and hygiene document with what is allowed and not allowed when in-person classes resume? They believe this will help ensure consistency among all school districts.
Yes, I believe that document is in process over at DPH, and then we're working closely with them, but since that's their expertise, is that correct?
Yes, Jan and Emily have done a wonderful job, and it's almost to the point that we can forward it to you guys to look at. So hopefully we'll have something by maybe Tuesday, if we can get it through all the approval for the next Tuesday call. So that way people will have a document in front of them. And again, this thing will be fluid. As you said, we're sitting over here, we're not education, you're bringing up issues that have not come to mind to us. And we want to figure out ways to make this a livable, doable process for you.
And that's one reason we wanted to have the setup with Dr. Stack today, take these questions. The questions, I know, just the issues have been informative to public health. as much as public health information is informative to us, and they will take that back. That doesn't mean every answer we get back in the final document we're going to like there at the local level or at the state level here at the department either. But we also know that public health exists to protect all in the Commonwealth and acting in our best health interest. So, and that's why we were asked, or they will be back on the call next week in hopes that that document is ready by then. We will then talk about that document and then, of course, take additional questions.
Okay. Another question, kind of in regards, and I just want to address it because it's at the top of the list, which means that several people have acknowledged it. It's on the Friday, new guidance and athletics is in conflict with the previous guidance because they're holding virtual summer academic programs and graduations. They want to know if they can start athletics within a couple of weeks, and they want to know if we can address this issue. So again, I think the answer to that is that we will get in touch with with Julian Tackett and see if he can get on the webcast with us next week to discuss some of these questions. Absolutely,
and he's normally monitoring this webcast anyway, and so if not, one of his staff probably has already heard this, but yes, we will. If that's the last question, I have just one or two.
No, there's more. I was just trying to get to.
Can we go about 5 more minutes?
Get to the ones that have been
Let's go.
Most.
Let's go about 5 more minutes if public health folks can stay on.
Okay. Let's see here. When will the issue? Well, I guess we kind of addressed this. When will the issue of school liability be discussed as it pertains to COVID-19?
I think the commissioner addressed
yeah,
that.
I mean, we can, if you want us to have a webcast topic on the immunities that districts have and discretionary functions that you do every day, and if we want to get down into that and talk about how liability works for school districts and the various immunities, and if that's something valuable to superintendents, we can certainly do that. I don't know that COVID-19 necessarily changes that analysis any more than any of the other riskier operations that you're involved in right now, such as transporting kids and all the other things that you do that have a level of risk. But we will be reaching out to our congressional delegation to see if there is any type of, I've heard of this, I haven't seen anything to show this is true or not, that there's talk at the congressional level about some immunity that would come through a bill for organizations due to COVID, but I'm not sure. Todd and Alan and Tracy Herman will be checking that out this week. So we hope to have a report to you on that at the next webcast. If it's something that, please tell us though through comment on the Go Soapbox if you want us to do a session at a future webcast on the liability issue, and this would be basically an overview of case law and liabilities and immunities that affect school districts.
So this is just another, when you had said they wanted to give an illustration, is the 30 students who are in Class A during first period may separate into 5 to 7 different periods for Class B during second period. That's at the high school level. So that's kind of what they're looking at when they're looking at a class schedule for this fall. And that was just in one particular district. So they just wanted to illustrate that for you in one question here. The next question is, if they do go back to school, is there going to be some sort of infection rate that would result in the closing of schools? Like, is there a percentage? Is there a threshold? Or is it just it just depends on what they're seeing?
That would be part of the contact tracing protocol of when to, that would be up to the local health department to decide that. Just like they do with a flu outbreak, there will be guidelines for when to close a school. And again, we're seeking those contact tracing guidelines from Mark Carter.
Okay. And then another question is, would face shields be a better choice for teachers? Face shields.
The problem with the face shield is the way that it fits. There's all this air circulating up underneath it. So if I'm infected, I have on a face shield and I'm breathing, laughing, and talking. Some of it's going to hit my shield, but there's going to be a lot of that coming out underneath that shield. So if I'm really wanting to not have any of my breath hitting somebody, this is how I do that. So you look at that and it's obvious that this is going to keep my excretions from getting in the air and onto somebody else, whereas a face shield is just not going to do that. I did a face shield with deliveries when I was delivering babies, and let me tell you, stuff comes up under that face shield in your face more times than you even want to think about, and it's a help, but it is not the highest quality work that you can do to try to protect others from your breath and your moisture.
All right, the next question is, the initial steps included in last week's slides included a quote, establish a healthy at work communications plan. Will a model plan be provided to guide districts in developing their plan?
Like a healthy at school plan from the governor's office? I'm not sure, but I will write that down and find out if they're planning on doing that. I'm kind of thinking that what we're trying to do, working with KDE on our weekly basis, coming up with these documents, will be the equivalent to a healthy at school plan. And the advantage is this is something that we'll be working together on a weekly basis that will be fluid, and we'll try to address issues that you have as much as possible rather than coming out with a document that's there.
And Tony, I think somewhat related to that question, I'm hearing from Jim Flynn at KASS that they are collecting and going to be a repository for school district reopening plans, so districts can learn from one another. And I'm also hearing that from Nancy Hutchinson that KEDC Co-op as well doing some similar efforts on some model type documents in that. And I know the other co-ops are doing similar, providing some similar services.
I think the next question that kind of summarizes a couple of these is going into, well, confidentiality. There's a couple that are concerned about with the tracing, the contact tracing, and ensuring confidentiality of their students.
And yes, that's if we don't have confidentiality, we don't have anything in public health. So when you do that contact tracing, again, whether it's for whooping cough or measles or tuberculosis or whatever your infection is that you're trying to find contacts, that has to be the utmost of confidentiality. The people that we're hiring, the health department people, take pledges for that. I think it's something that we can be pretty proud of, that we do not, we've got enough layers of passwords and things that security is high for this. It's important to us that this kind of information not get out to anyone.
Do we know, Commissioner, when they will know what they can legally do? Do they have a timeline in terms of when there might be a waiver of additional NTI days for the fall? They're saying it's hard to do anything innovative with these restrictions and or recommendations.
You can take it to the bank that you're going to get additional NTI days for next fall. We are going to do that through the governor's emergency executive order authority. Even if we did not do it through that authority, I am confident that the General Assembly would have gone back and made that retroactive. But when they meet in January, but we certainly understand the anxiety there. So we anticipate asking to do a similar executive order like we did for the cabinet secretary, who is the lieutenant governor, asking for that, just like we did with the civics test legal requirement on or around June 15th. That's what we're shooting for internally. That's the easy part's the NTI part. The hard part that we want to include in the same designation, the same executive order, are those things we talked about attendance and other things, issues that are being raised if we go and we are, and you are making plans on this hybrid model. How do we count students? How do we ensure that the funding flows appropriately to you when a child is not sitting there every day of the week, but yet they are still in full attendance, things that we've never fully really contemplated up until now. So the answer to the question is by mid-June.
All right, and then another question, do we have information yet on funding from the General Assembly to support Senate Bill 1? We have received no information and need to hire people and pay for facilities.
Charlie Harmon, are you on? Can you answer that quickly? Or Matt Ross? I know that's a question we answered about a week ago, and I know that there is an answer to that. I don't recall what it is, where we are in that process.
I'm not sure if they're on. I think they were on earlier, but they may have had to sign off.
We will get an answer to that question. If we can send the answer to that question instead of waiting for the webcast next week, Jennifer, if you can flag that and do an email from me to all attendees on the webcast, either this evening or early tomorrow morning.
Okay. And then I'll see if I can wrap it up here. Again, another question in regards to school safety. Senate Bill 8 requires doors closed and locked at all times. So perhaps another possible webcast would be to have, John Akers or school safety also involved. Or maybe that's something that education continuation could look at, the task force.
Yeah, we're asking John to take a look with a new set of COVID eyes onto all those things, and there may need to be give and take on both sides on that. So depending on the health implications and weighing that against the safety implications. So John will be working in tandem with public health as well as KDE staff on that. So we're at 4:10. So we're going to close it off for today. Tony, any questions that are still on that were unanswered? If they're public health related, get those over to public health, and we'll start the webcast next week with those. For the topics we did not get to today, that was the pandemic EBT program. You heard the governor talk about that at his daily press conference one day last week. We're very pleased Kentucky is now on board with that. Your food service director should have received an email from KDE. There will be a webcast on the pandemic EBT program, or called P-EBT, and that's the Electronic Benefits Transfer Program, a special program during the COVID-19 pandemic, obviously working through the Cabinet for Health and Family Services to get that approval from the federal government. We're very appreciative. Obviously has an impact on our school children. That webcast is the May 29th. Went to your food service directors. We will also send that link to you. Jennifer, if you can make a note, also just put that link in the email that's going out tonight with the answer about the Senate Bill 1 funding. And then the last that I'll say, and then of course, the social emotional health reopening guidance, because we're deferring that to next week does not mean it's not important, but we just had this we wanted to get through today. So we will have Dr. Foster and Dr. Sweeney on for next week's webcast for the social and emotional health, in addition to, of course, opening up again with public health. And then lastly, I wanted to leave you with, I've heard from many of you that you'd like to see more superintendent involvement. As I've stated, the superintendents are proportionally have more representation on the continuation education task force. However, I have heard you. The Commissioner Superintendent's Advisory Council was not set to meet again until September, until further notice, either until I'm gone or the new commissioner wants to put you on a more regular basis. I'm calling in the Commissioner Superintendent Advisory Council to meet every other week, hopefully beginning next week. So, and we're going to try to alternate weeks between the task force and then the Superintendent's Advisory Council. A final thanks to our Department of Public Health partners and colleagues. We thank you for your work. We know you all are working day and night and on behalf of the Commonwealth, and we appreciate that, and we look forward to seeing you here, same place, same time next week. And to everyone out in the school districts, we hear your anxiety, we hear your frustration, and that is to be expected. But I do believe that Kentucky, of any state, will be able to do this and give a good faith effort at keeping kids healthy and safe, but also giving them a good education next year. And I know we can do it. Everybody have a great rest of the evening, and we'll see you back here online.
Bye, everybody. Thank you.